doctors, I have 3 beautiful kids, but they left me with this loose, saggy skin on my stomach. Should I get a personal trainer and hit the gym even harder? Or should I talk to a plastic surgeon about a tummy tuck? Or is there another doctor that can help me take care of this less invasively?
Well, Dr. Sandra Lee is back with her patient who you just met in the video. Kelly, how are you?
Hi, good.
And so the question is, we're talking about loose skin after pregnancies. So who do you go see? What kind of doctor for loose skin in your tummy? Is it the plastic surgeon or is it the dermatologist? Potentially both. So I had the opportunity to examine you before we started the segment. I mean, you are buffed. You are in good shape, but you have that loose skin. And unfortunately, no amount of diet and exercise is going to cure that. So, there's a number of options that you can do, and I think you did all the right things leading into your pregnancy, during pregnancy, and after. You took good care of yourself. You're going to the gym now. Your muscle tone is great. So you've done that option. Number 2 is coming to see me as the plastic surgeon. And you are a good candidate for a tummy tuck. And because you're so in front, we could do what we call a mini tummy tuck through a small incision like that, tighten those muscles, and just remove that little bit of overhang. So that's the second option. But finally, that's where Dr. Lee comes in. We have so many great non-invasive or minimally invasive procedures to get some skin tightening.
If somebody doesn't want to go through a more invasive procedure, if they don't want to have surgery. And I really have here the newest and the greatest of all the radio frequency devices. This is Reaction by Viora. You're able to treat at multiple frequencies, and so you can be more specific with the depth in which you're treating with this device. You can treat cellulite, you can tighten skin, and it has vacuum as well, so you can suck the tissue up and you can even penetrate more deeply. And we can even use a specific handpiece here to actually target stretch marks as well, so we can help to improve stretch marks.
So it's twofold. It's getting some tightening and also helping stretch marks. How's that sound?
Let's try it, right?
And you can do a little bit.
Let's fire it up here. Yes, we're going to show you what it's like, and you're going to be so nice to hold the temperature sensor.
And this is the temperature sensor because it's so important.
You can see how it's vacuuming up,
it sucks it up in there, pulls it in.
And we can go back later and change the handpiece and actually directly try to improve the stretch marks as well.
How's it feel?
It feels like someone's pinching me,
so,
but not hard.
Kelly's a good candidate.
Yes, Kelly's a good candidate because she's already so fit, and we just have this one trouble area, and also because she doesn't want to go through a more invasive procedure. And you can use this to treat all areas of the body. The neck is a very popular area, the thighs, the tush. So it's really just a great and easy way to no downtime.
How many treatments is she going to need?
6 to 8 treatments, really spaced every 2 weeks, and it's about $1,200 to $2,000 for the package, like for 6 treatments.
And I know, Dr. Lee, you brought some before and after pictures supplied by the company of what kind of results. Obviously, I think this appears after multiple treatments.
Well, that's 4 treatments. 4, 6
I mean, those are pretty dramatic changes.
Yes.
I mean, you can still see some laxity there that you can get out surgically, but for someone who doesn't want surgery,
this is a nice option. Yes, I agree.
Part of the deal here, Dr. Lee has been so kind enough to agree to do a couple more treatments for you and get you in shape. I'm jealous. Thank you, Dr. Lee, and thank you, Kelly, for coming in. You're going to love it.